Well, it is 18 minutes gone past 5, and you're still tuned into Smooth 98.1. But it is time for us to get into Smooth Health. And yes, seeing that it is Men's Week, or well, at least us getting to share updates on men's health, I decided that, well, not just myself, we decided to talk about something that affects the men. But sometimes they feel like this topic is a very scary subject to have a conversation about. So I decided to go searching for the doctor that will definitely be able to break things down as easy as possible. And I have with me in the studio, well, virtually, I have Dr. Abiola Ajayi. He is the MD CEO of ROA Specialist Hospital. And good evening to you, Dr. Ajayi.
Good evening. Thank you for having me. I appreciate it.
Okay, so Lagos, you can as well be a part of Smooth Health today. You can send in your thoughts or questions on WhatsApp on 009 4440981, as well as join us on YouTube at Smooth981. And you can actually watch the live stream as well there. So, talking about understanding vasectomy, it is something that people, well, let me not say people, the male folk are usually very skeptical having a conversation. Well, they're dodgy when it comes to vasectomy. So I want you to first break down what a vasectomy is.
You know, even before I address your question, I have to just say something that's strange. I love this topic that you invited me for. I appreciate it.
You're welcome.
And what I've seen in Nigeria as opposed to my practice in the US is completely 180 degrees. It,
Oh,
you know,
no.
in the States, men opt for vasectomies all the time,
Mm,
and for our listeners out there, a vasectomy is where a man undergoes the procedure so
okay.
that he no longer can impregnate a woman. It's
Okay.
not that he cannot have erections, it's just that he can no longer impregnate a woman. And but I have had so many lectures and so many discussions about family planning,
Okay.
which is, spacing out your children or
Mm,
knowing when you want to get pregnant and not want to get pregnant. And
yeah.
99% of those talks center around the woman doing something,
Indeed. Mm. Which
That's just
also
this
messes up with the
environment.
hormones,
But
but you know what?
what's your WFM? You tell me. What do you encounter?
Well, when it comes to that
Sorry.
family planning and all,
Yeah.
it is usually like you said, put up on the woman. And to be candid,
Everything
it messes
on
up
the
with our
woman.
hormones. But hey, what do I know? You're the doctor,
Oh,
you
yeah.
tell us more.
We'll talk about it. I'm ready.
Okay, so I know that there are types of vasectomy, right? So I like you to highlight or give us more insight into the types that there are actually.
Okay, so vasectomy, and I may not have answered your question at the beginning. It's a surgical procedure,
Okay.
and it's a type of male sterilization. So it's a
Okay.
way of, you know, sterilizing the man, meaning the man should not be able to impregnate a woman.
Mm-hmm.
And briefly, you have female ways of sterilization. We have
Mm-hmm.
something called a tubal ligation, where they go in and do a surgery and
I
cut your
can see that.
tubes and burn them, or as they say, tie the tubes. Exactly. So, so that there's that procedure. And if you were to
Okay.
compare this procedure, for the man and the procedure for the women is night and day. The woman's procedure is a major procedure. This is a very minor procedure.
Mm. Oh,
But
okay.
yes, and and I plan on highlighting that as we talk, because let's highlight these women. That these Nigerian men need to soften up, change their attitude a little bit. But anyways,
Okay. Now that you
don't
make
let me get off
mention.
track. Don't let me get off track. But I have a little bone to pick. Because I
Oh,
see these
okay.
people. I see them every day. I see them every day in my clinic, and I'm constantly educating. You know, life's a partnership. Life is a partnership. So your wife is just as important as you are, and sometimes it may not be convenient for her to go through a surgery. But this kind of thing is very simple.
Okay. Okay, so now that we're even talking about a vasectomy, I know that there's the usual fear, right? Uh Regarding it. But I like the fact that you said it's a very small procedure as opposed to what the woman will naturally go through. But is it that when you have a vasectomy, it's permanent, or are there reversal options?
Yeah, well, it's it's a as we are supposed to sell it to the patient, as I sell it to the patient, I sell it to them as as a permanent solution. That's how I
Okay.
sell it to the patient. But
Mm-hmm.
depending on the method, the type of the vasectomy, and I never mentioned that you have a classic type where it's an incisional method where you take a knife and you cut on the scrotum.
Mm-hmm.
And men out there that are listening and clutching their balls or clutching their scrotum, it's not that serious. They'll
Okay.
give you a very small injection that will numb the place, and and
Mm.
and you're not given anesthesia more than that, and you won't
Oh,
feel it afterwards. No, you can just numb. There's a way you can just numb the nerve that just
okay.
applies sensation to the entire testicle. And
Mm.
there's a technique even where you don't even make an incision on the scrotum. You just use
Okay.
your instrument to spread the place, and you make an incision further in. But it just depends on the doctor's preference or the urologist's preference. But
Okay.
sometimes you can go in there, and there's a tube you're looking for called the vas deferens.
Mm.
Once you find the vas deferens,
Mm-hmm.
the type I do, I put a clip on one end and I'll stitch the other end and
Okay.
burn it. So it
Mm.
just depends on what you were taught, but it's pitched as a permanent solution, but you can obviously reverse them. We'll talk about that later, I'm sure.
Oh, nice. Interesting. Okay, Charles Studios it comes to me and says, the only time I get to discuss about men's health on Smooth Health, I suddenly come up with a vasectomy. What is my plan? My plan is to help educate the men, Charles Chidozie.
Thank you.
Nothing, nothing else. Okay, so but it is important to actually, family planning. Yeah, it
Family
is something
planning
that we all, the man and woman, need to be involved in, and it's not one-sided. So hey, what
and
was
us as Africans, because that's
mm,
what actually progressed the Western world, and let me say the Eastern world in terms of China. There was
okay?
a long period of time where they only had one child. I'm not saying I'm happy with it.
Okay, you're muted.
China, you
Okay.
know, towards a direction. So I'm just saying very important to it's very important to keep track of the offspring you have. Can you support them?
That's
Can you
very
support their faith?
important. Hmm.
Yes, I think it's important, and I don't care who knows. I'm not trying to say I'm not talking about population control or anything stupid like that. Just saying,
Okay.
plan your family.
Planning your
Plan your
family.
family. You want to have
Hmm.
8, no problem. Just plan them.
Make sure that
That's
you
all.
have the resources to
It's
be able to cater to
resources.
them as well.
Exactly.
Yeah, I
Exactly.
like that. Okay, so but um yes, we know that when it comes to vasectomies, there's the permanent, there's also the reversal. However, is
Yeah.
it very effective?
Talking about the reversals.
Not like
Yeah.
vasectomy in
Oh,
itself.
in
Is it
general, yeah.
yes.
The vasectomy in general is not 100%, but in most scenarios is 99% effective.
Hmm.
And
Okay, so
there are a few instances where somehow one side will open and sperm will find their way.
okay.
Everything happens on on God's planet, but they're 99% effective.
So there could be a point in time where some linkages might just come through. So yeah, interesting. But at the end of the day, are there any side effects or complications to be worried about? Because, uh, like you said, this is Africa, and we get to see things on a different angle. I saw a clip recently that um a doctor went on the street to just ask about family planning. And
Hmm.
when he asked about vasectomy, the man said, no, it's not happening. That's it. The woman should
Exactly.
be the one to go through the process as opposed to them, because once they get snipped, that's the end for them. There's no way they will not be able to function. They feel that there's no headway after that. So I'd like your thoughts on that. Like,
That's an excellent question. That's probably the most important question of the evening.
mm,
It has A vasectomy has nothing to do with your manhood. So your erections are not effective. It's not affected at all. It's very far. The surgery is very far, and I pause to even call it a surgery. It's very far from what controls your manhood. So your erections will not be affected. Your ejaculations and your will not be affected.
mhm,
It's not that. This is merely something that will keep you from getting someone pregnant. And then, like I said at the beginning of the show, when you compare it to what a woman would have to go through to have the same kind of procedure,
mhm,
it's by no, a woman, it's an abdominal procedure. You have to open the abdomen and do that. This, you just make it very, very, very tiny incision of the scrotum. By within a week, the man has returned back to full duty. You
mm,
have to take one day on the couch, right? Then the next 5 to 6 days is just reduced activity. You don't work out, you don't go and play soccer or anything stupid like that. But after a week, you should be able
you're
to,
back to.
yeah, get back to duty. And it's not like you can't work. You're just working as you're, not straining yourself for at least the first week. After that,
Mm.
it's not a big deal. As opposed to the woman, she would have to take 3 to 6 weeks off to recover from the procedure.
Oh, okay. Oh, so that's how long the procedure would be if it was that of a woman who was going through a
Yeah, well,
tubal,
and the procedure I'm describing is a bilateral tubal ligation, or
yeah,
some people
tubal
call it
ligation, yeah.
BTL.
Mm-hmm.
Exactly. 3 to 6
Mm.
weeks, depending on the method.
Oof, what we go through. But you know what? We're
Exactly.
still tuned. You're still tuned into Smooth Health. And yes, it's an insightful discussion we're having today, and we're talking about men's health. Yes, indeed, focusing on vasectomy and family planning. It is something where it's sort of a touch and go topic for the male folk, but it's also important to have those conversations. But we will talk more about care and long-term health risks that are associated with having a vasectomy. Let's take this quick breather. On the other side, we definitely will continue the conversation. Don't go nowhere. Stay tuned to Smooth 98.1.
Mobile observation that helps you. This is Smooth Health on the Drive. From the field.
So for those who are usually scared, there's nothing to be scared about.
The Ladies in Sports Conference 2024 is igniting the lights, inspiring greatness, one woman at a time. We're expanding the business for women in sports. Join us at the Marriott Hotel Ikeja from the 5th to the 7th of June 2024. Don't miss the conference. It's gonna be prime. This event is proudly sponsored by Stanbic IBTC, Bet Niger Foundation, Mamador, and Smooth 98.1. Meals have a way of taking us on a journey. And when you add plenty of vegetables like a fork, and season with the rich taste of North seasoning cubes, even better. So go ahead and elevate your meals with more vegetables and the rich taste of no cubes. Today, eat for good. In a world where your health is your greatest asset, you can trust us to care for you and your loved ones. At Evercare Hospital, Lekki, we understand the importance of compassionate care and medical excellence. From routine checkups to specialized surgeries, our team of experienced doctors are dedicated to guiding you through every step of your health journey. At Evercare Hospital, Lekki, our state-of-the-art multi-specialty tertiary care facility delivers a wide range of services across core medical and surgical subspecialties. Experience compassionate care and cutting-edge treatment at Evercare Hospital, Lekki. Your health is our priority. Contact us today on 0813-985-0710, or you can visit evercare.ng to schedule your appointment. Evercare Hospital, Lekki, transforming healthcare in Nigeria. This is Smooth Health on the Drive. The global observation that helps you. This is Smooth Health on the Drive.
All right, so 6 minutes gone past 5, and yes, you've still tuned in to Smooth Health and Smooth 98.1, your love music, love life station. And yes, today on Smooth Health, we are discussing understanding vasectomy, and my guest is Dr. Abiola Ajayi. He's the MD CEO of ROA Specialist Hospital, and he's been giving us insight on, well, vasectomy and all that you need to know, talking about how it is a means of having a family planning. However, it's also uh, a preventive way for the male folk. It's not painful as opposed to, and hey, like Dr. Day earlier stated, it isn't something you get to experience a lot of pain. It's no pain at all. It's just a quick surgical procedure, and that's it. However, hey, 99% guarantee for it to work, as usually is stated. It usually isn't always 100%, but 99% coverage. At the moment, seems the gremlins are holding on to the network, and I can't seem to get Dr. Jay to get in. But as soon as we're able to get him to come back on, we'll definitely continue the conversation. But don't forget that if you have any questions, you have any contributions as well, you can as well join in and share your thoughts. And well, one of the key things that you also that Dr. J actually spoke of earlier is that there are no side effects or complications when it comes to having a vasectomy. It is dependent on the procedure that the doctor decides to go through with. Just a small incision, just snip and, nip tuck here and there, and you are good to go. But yes, like I said, you can share your thoughts as well on WhatsApp on 009 4440981 is the number to share your thoughts with me on WhatsApp. And well, you can as well let me know what you also think with regards to vasectomy and the likes. And Dr. J, when he gets back in, I'm hoping the gremlins won't hold on to him uh, for so long. He's trying to connect, but I don't know what's happening. So let's just give him a few minutes and see how hopefully he gets back in. All right, seems the network isn't letting us get through. The gremlins definitely are getting ahead of us. But hey, well, for you to get more insight on this, well, you can reach out to Dr. J, and he can actually give you more update on how, you can get get more insight when it comes to understanding vasectomy. And I know that he has so much more insight to give. I know that Charles Cheetahs asked the question here. Uh, and he says, since vasectomy isn't 100% guaranteed, what's the need going through the process? Well, I'll just stick to my other type of game. Well, Chelsea is here. Even the doctors will tell you that even that isn't a guaranteed way for you to go. But hey, I'm not the doctor here. And I know that you can actually reach out to the doctors. And you would definitely get more insight into how you can stay on top of your health, what you need to do when it comes to being protected. Bearing in mind that when it comes to tubal ligation, that is for the female folk, hers takes a longer process as well as longer time for her to heal. But like Dr. Jaya had said earlier, it takes just within 5 to 7 days for the man to heal. Well, 5 to 7 days for him to heal, as opposed to 6 weeks that it will take for the woman to heal when she's gone through her own procedure. And this is as a result of how, swift it is. It's non-invasive. It's just a nip tuck and you actually are good to go. It doesn't affect any of your organs, as he also stated. So, but it is something that you also want to think about when you're also thinking about family planning and the best way to go when you're trying to, you know, have a moderate sized family or whatever planning you are thinking about when it comes to your family size as well. Bearing in mind, like he said, hey, there's the permanent one, and there's also the reversal. So it's not like if you go through this process now, you can always change it much later. Well, there are always procedures where you can actually do that much later, and that is one of the interesting parts for me. I was actually hoping Dr. Jay would be able to speak to that as well, and that's talking about the reversal, because some people always think, oh, if you just do that, that's the end of it. There's no way for you to come back from that one. But for you to get more insight, or for you to ask Dr. Jai more questions, you can actually reach out to him on Instagram or on Twitter as well, at ROA Specialist Hospital, and he will definitely address whatever questions you have and be able to, excuse me, guide you as best as he can with all the questions you might have. How safe is it? When how considerate would you have to be in order to ask your partner so you are both on the same page? What questions you also need to be asking your doctor as well before you even go for the procedure. So those are the things